Welcome to Science, Health and Healing Encyclopedia. I am Dr. Majid Ali. The title of this video, Steroid Injections for COPD, Chronic Obstructive Lung Disease. In the past, it used to be also called emphysema. So a viewer asks me what is my opinion about the use of steroid injections for COPD. In acute illness, when a person is short of breath, I would do anything to stop that. If it means steroid injections, I will. But I will tell you that I have never had to do it so far. And I've seen many patients with COPD, pulmonary interstitial fibrosis, interstitial pneumonitis, chronic. The reason we can avoid is because we focus so much on the colon fermentation. I believe that chronic obstructive lung disease has a structural component which may have come from a lot of different reasons, but there is a major component of inflammation. Whenever you want to dry up the lungs, dry up the wet lungs, and clear up inflammation in the lungs and excessive mucus production, I always focus in the colon. I actually consider the inflammatory component, which is the active component of COPD, as a problem of the colon. Yes, fermentation in the colon then spreads to small intestine, then it spreads to stomach. People call it GERD, gastroesophageal reflux disorder. And pulmonologists and gastroenterologists will readily agree with me that people who have more COPD, they tend to have more GERD, and people who have a GERD tend to have more pulmonary problems. But if you ask me how to avoid steroids, I would say focus on the colon, focus on the colon, focus on the colon. But when you stop fermentation in the colon usually is related to sugar and antibiotic abuse, failure to detect and treat mold allergy, food allergy, gut fermentation, leaky gut state, excessive productions of mold toxins. Now I give you scientific basis of everything that I've just mentioned. The articles are on aliscience.org and alihealing.org. Now, one other thing that I especially use for my patient is glutathione with nebulizer. I usually give them 25 milligrams of glutathione in 20 cc's of sterile water to be used with nebulizer. 9 out of 10 patients will come back and tell me this really helps. Of course, control of fermentation in the colon, small bowel, stomach, as well as in the bowel and the liver, that dries up the inflammation. So my short answer is, I've not had to use steroids because there's so many things. When I have acute problems, I will use intravenous hydrogen peroxide, oxygen therapy, large doses of B12, large doses of magnesium, multivitamins. The purpose is cut down inflammation, cut down inflammation, cut down inflammation. And if you do that, you don't have to use steroids. Remember, steroids work in COPD by cutting down, suppressing inflammation. But unfortunately, they also suppress the immune system. I thank you for asking this question. It allows me to cover some aspects that ordinarily I would not have thought of covering in the context of chronic lung diseases.